Hi everyone. Hi Rana. Can you do our proper introduction so we can start?
Yes, sure. So
Okay.
thank you everyone for joining us today. As you all know, the holy month of Ramadan is approaching, and we are here today. Dr. Milena, Dr. Cigdem, our two wonderful endocrinologists at Blue Care, and myself, Rana Sultan, clinical dietitian. We will be discussing the effect of fasting during Ramadan on our body and also providing you with some dietary tips for better, probably food choices for iftar and Suhoor. So we'll start with Dr. Milena.
Thank you, Rana. Thank you everyone for joining us. I will start my presentation. Please let me know if you can see it. Can you?
Yes, Milena, we can
Yeah.
see it.
Thank you very much. So, as Rana mentioned, Ramadan is coming, and we decided to bring this topic because we know that the Ramadan includes the intermittent fasting. No? During the whole month, Muslims are obligated to do a time restricting fasting, and is considered as a religious obligation. But of course, some patients, pregnancy or with illness, they can be exempted. And once we work as endocrinologists in a bit center, we can approach also with Dr. Cigdem the type 2 diabetes and type 1 and type 2 diabetes approaching this whole month. But to start, I'm going to explain a little bit about how the intermittent fasting make different in our body, in our hormones. And who knows me know that I always try to bring studies with evidence, and which was not easy. I have been studied so hard about intermittent fasting this whole week to bring you guys what is most important regarding evidence. So we're gonna do this quickly because I want to focus on a Q&A section, which I love most because I think it's more interesting. So please drop your message with your questions when you finish. So what is the physiology of the fasting? We know that it's a major shift from the normal eating patterns to exclusive nocturnal eating. So this can out. There is some echo here. I don't know what's happening. Let me see. Maybe if I'm reducing his. We know there's some alterations in our hormones. And the early morning is marketable by huge carbohydrate intake to give us energy to sustain during the whole day. But during the afternoon, when our energy, our stock of energy is going down, the lipids, the fat becomes more important during the whole day until the iftar time. So fasting is together with alterations in some hormones, with sleep, activity patterns, and alterations in many hormones as cortisol, insulin, growth hormone. But what we know that restricted diet, so diet restriction, no matter if it's intermittent fasting or low carb or low protein, can lengthen the lifespan. So any type of a restricted diet can increase our lifespan. So what is the benefit for calorie restriction? Many studies show that we have less inflammation. So less inflammation as type 2 diabetes, less inflammation in fatty liver, in obesity. And also there are some studies for diet restriction that can reduce the signs of aging. For this reason, intermittent fasting becomes more common now. You know, in US, more than 10% of the population now do intermittent fasting. The As obesity becomes like a more common disease, they use this approach for weight loss. So we know that a reduction in body weight can occur when patients they do intermittent fasting for 1 to 3 months. But we couldn't find any study for patients who does more than 1 year of intermittent fasting. So majority of studies they do 1 to 3 months. So we know that intermittent fasting, there's so many types. We have one type in which is time restricted, for example, 16/8, or alternative days. And both types of intermittent fasting can reduce your body weight. I found one very nice study about healthy non-obese patients. They fasting for 44 days, and they have a reduction in fat mass, but also reduction in fat-free, in lean muscle mass. Okay? The variation between the 1 month, between the days of the weight loss also is different. So in the first week, the average can be around 1 kilo per day of weight loss. In the end of the month, there's a reduction and no one keeps the same amount of weight loss. And in the end of 30 days, this weight loss can be around only 300 grams per day. So here is so we saw the positive points, improve insulin sensitivity, improves leptin, and also reduce the weight. But there's a negative part. The fasting is associated of reduction of the sleeping time, and also increase the naps, increase the daytime sleepiness. So it's very common, especially during Ramadan, there's a delay, the time to go to bed, and also fluctuations in the mood, especially in the first and second week, and reduction also in the work performance. So this is like a brief thing for the benefits and negative points. And I will pass to Dr. Cigdem. She will address what we do in the clinic for the patients with diabetes. Then Rana will do the part from the meal plan. Okay? Thank you so much.
Thank you, Dr. Milena. We will continue with Dr. Cigdem, and if there is any question, we will cover all the questions at the end in a big part for Q&A session. Dr. Cigdem, we are not able to hear you. You need to put your mics on.
Okay, perfect. Okay, thank you so much, Rana and Milena. Today I'm going to talk about what we should do during Ramadan. And also I will try to keep it short because we want to take your questions and we want to answer them in detail at the end of our webinar. Thanks to all for joining us. Let me start my presentation. Can you see my screen?
Yes.
Okay, perfect. So we have many diabetes patients. Of course, the question is, what should I do before Ramadan? We strongly, first of all, advise you to get your pre-Ramadan risk stratification and consulting your healthcare professional 3 weeks before Ramadan. This is very, very important. Of course, Ramadan is a holy month and we all want to fast, but of course, we need to understand risk category first. The first category is, and we have in the IDF, we have a risk stratification for diabetes. And in the first category, it's very high risk, and these patients must not fast during Ramadan. If you have one or one of the followings, then you shouldn't fast. If you have severe and repeated low blood glucose events 3 months before Ramadan, if you experienced any diabetic ketoacidosis, if you have kidney problems and kidney dysfunction, if you have poorly controlled type 1 diabetes, if you are facing any acute illness, if you are pregnant, if you have heart problems, especially atherosclerotic cardiovascular disease, and if you are old and with an ill health, then it will be too much risky for you to fast. And in that case, we do not advise fasting. The second category is high risk. Should not fast. We prefer not to fast. If you have one of the following, then you shouldn't fast. Like, it's not as much as risky in the first category, but again, we advise not to fast to this second category. If you have poorly controlled type 2 diabetes, if you have type 1 or type 2 diabetes treated with multiple insulin injections, and if you are using insulin, again, if you are pregnant, if you have kidney problems, or if you have complications related with diabetes, or if you have a physically demanding job and if you are at risk of hypoglycemia, then fasting may be dangerous for you. So we recommend not to fast. And treatment, if you use treatments which may interfere with the mental function, then you shouldn't fast. Why this is important? Because, in case of hypoglycemia, in case of fasting and hypoglycemia, we get alerted and we understand that we need to break fasting. We need to do something to prevent hypoglycemia or to prevent severe hypoglycemia. But if you are taking drugs which may interfere with this, then fasting may be dangerous. It may put your life at risk. Then we advise not to fast. The other categories, if you have well-controlled type 2 diabetes, if you are using just tablets or injectable medications instead of insulin, of course, but if you use like basal insulin, it can also be acceptable. If you are using your dose, your diabetes is very well controlled, then you can consult to your doctor, of course, before deciding yourself, and you can fast in that case. And also, what are the important considerations for fasting safely? After you consulted your healthcare professional, your doctor, and you learned that you can fast, it is not that much risky for you, then of course, again, we need to be careful. First of all, you get your risk stratification and you know your risk and you will behave in that way. If you shouldn't fast, then please do not fast. And of course, blood glucose, if you are allowed to fast and if it is okay for you, of course, blood glucose monitoring is very important. Your diabetes may be well managed. It can be controlled, but our life is different. So you may have different situations in a daytime, and every patient and every person is unique. Even though you are allowed to fast and you have diabetes, you should monitor your blood glucose. Luckily, now we have CGMs and we have blood glucose monitoring devices, and they are really, really helpful. Rana will give us advice about the dietary tips, how we can avoid hypoglycemia and how we can fast in a more comfortable way. And also fluids is very important. Before Iftar and Suhoor, we should get very, very well hydrated because kidney function is very important. We are always speaking about hypoglycemia, but also hypotension is very important, and you need to get enough fluid to protect your kidneys to avoid any hypotension, which means low blood pressure as well. We will shortly speak about exercise advice. It's very, very important. Ramadan is a holy month, and actually it's a good luck to do some changes. We will discuss how to do it. And also your medication adjustments is very, very important. If you are taking especially like basal insulin, if you are taking any diabetes medications, especially now we are not using that much, but previously we were using medications which can cause hypoglycemia. So you need to check your medications with your doctor to do your adjustments on your medications. You can decrease the dose, especially for blood pressure medications, for diabetes medications. So this is a very important point in your management. So consulting to your doctor before Ramadan is the very, very key point. And also you need to know when to break the fast, because we assume that you will not have any hypoglycemia, and we think that yes, you can fast, but you need to understand when to break the fast. And if you are realizing that your blood glucose is going down, at that stage you need to interfere, because your health is important and you shouldn't put your health at risk, even though it's very important. Yeah, I will take your questions later at the end of our webinar. Now I want to switch to Ramadan and exercise. Actually, there is a question that can I continue exercise during Ramadan? This is again a very personal approach, but as physicians, we advise you to continue your exercise during Ramadan, but it shouldn't be like very intense, very heavy. So it allows you and it helps you to also, it gives you a chance, if you start exercise like slowly, and if you help your body during fasting with exercise, then you may get it as a habit and you can continue even after Ramadan. It will help you to lose weight. And also during fasting, weight loss occurs, and you can also put some additional effects of exercise on it, and it will help you to lose weight and to lose some fat tissue as well, because you are fasting and your body will lose glucose first, then it will lose fat tissue. So it will help you to burn fat tissue and adipose tissue, which is very helpful for your body. It will also decrease inflammation, as Dr. Milena mentioned in her speech. So what time of the day should I exercise? Maybe the second question. Actually, before Iftar, it revitalizes your body and it increases its efficiency in getting rid of toxins, and it's helping you to get rid of stored fats. So it will help you to lose weight. But this is very, very personal. If you find it comfortable doing after Iftar, it's also acceptable. You need to do it when you enjoy it to make it more sustainable. And actually, the critical thing is during fasting, your exercise should never exceed like 60 minutes for a maximum of 5 days a week. And the physical activities practiced in Ramadan should be low or medium intensity, and they shouldn't require any high resistance that may exhaust the body. You should listen your body, and you should do the exercise which you enjoy and which you feel comfortable. You shouldn't put your body at stress, and it shouldn't exhaust your body. Thank you so much. Now I will pass the speech to Rana for further dietary tips, and we will take your questions at the end of our webinar.
Thank you, Dr. Cigdem. So again, yes, I will share my screen. Are you able to see my screen?
Yes, Rana.
Thank you. So I'm going to address the dietary part during Ramadan. And what is Ramadan from a dietetic point of view, dietary point of view? It is the abstinence of eating from sunrise to sunset. So it's a fasting during a long period, and our food intake will be concentrated during the other period, which is between the sunset and the sunrise, and mainly concentrated on two meals, which are the iftar and the suhoor. So our challenges throughout this month are mostly to control our blood sugar, if we are diabetic, of course, and to maintain a healthy weight, because a lot of people can gain weight because we indulge sometimes too much on fatty meal, sugary food, dessert. So we find at the end of the month that we have some extra kilos, and constipation and dehydration could also be two problems that are frequent during the holy months of Ramadan. So I'm going to talk about this a little bit step by step in a quick way and cover how we deal with them through our iftar and suhoor. So to control our blood sugar, we should keep in mind that we should be careful about the carb-rich food, the food that are rich in carbohydrate, because these food are the one that are going to produce sugar in our body. So to control our blood sugar, we should be careful from 3 points: the quality of the carbohydrate that we are choosing, the quantity of the carbohydrate that we are eating at one meal, and how we are eating the carb, our meal composition. So to control blood sugar spike coming from carbohydrate, it's very important to choose what we call the low glycemic index carb and not the high glycemic index carb. So if you want to use more common term for the low glycemic index carbs, it's the carbs that enter our blood more slowly. That's what we call the complex carbs, if you want. So what are these complex carbs? In a very quick way, they are mostly the carbs that are rich in fiber. So it's always better to choose whole wheat bread, for example, to choose instead of the regular rice, brown rice, or even basmati rice, to choose more pulses as the source of our carbs, like lentils, chickpeas, beans, because they are very rich in fiber, quinoa, a little bit of oats, vegetables, of course. So choosing these carbs is, of course, better than choosing the simple carbs. Again, even if we're choosing low glycemic index carb, the quantity of carb at one meal should be controlled and should be small, because even if we're choosing low glycemic index carb and we take a very big plate of rice or any kind of carbs, it's going to make our blood sugar spike. And how we eat these carbs, we should never eat them like purely alone. We should always combine them with some vegetables and protein, because this will help us to control the portion and having some satiety. And at the same time, the presence of the vegetables and the protein will stabilize better our blood sugar, not to have the blood sugar spike. As for the weight, again, we should have a balance in our nutrient and try to be careful from the nutrients that are calorie dense. To be able to control our weight, it's very important to control our calories. We should not have excess calories, because otherwise we will end up having a lot excess kilograms in our weight. So to control our weight, we have to control our calories, and of course to control the portion, the quantity of the food that we are eating. So we should always have a balance of nutrient, because we don't want to have any deficiency during this month. But we should be particularly careful about the food that are very high in fat, because fat is very caloric. And in Ramadan, there is plenty of dishes that are high in fat. And we should also be very careful of too much sugary food, because again, they will be adding a lot of calories without a lot of nutrients. The portion, again, if we apply what we call the healthy plate method, which is a combination between vegetables, protein, and healthy carbs, it will help us a lot to control the portion, to eat smaller quantity, but with having satiety and not feeling that we are still hungry. As for constipation, we should focus on three main things. Fiber. High fiber food should be included in our iftar and suhoor. And fiber are mostly found in vegetables, especially cruciferous vegetables, in fruits, dried fruit, which we consume a lot in Ramadan, are excellent source of fiber. pulses, they are really the richest food in fiber. So lentils, chickpeas, bean, they should be our source of carbohydrate because they are low glycemic index carb and very rich in fiber, and some seeds and bran. All this are very important to have enough fiber. Hydration, Dr. Shida mentioned this. Drinking a lot of water is very essential to prevent constipation, but also hypotension would could happen in Ramadan, and dehydration. So drinking water several times, reminding ourselves at least during the eating period to drink at least 1 cup of water every hour to be able to reach our requirement of fluid, and exercise, of course, for constipation is very important and it could help a lot. So how can we apply these recommendations that I gave very quickly, if you want, by practical tips and practical food to our iftar and suhoor? If we take iftar, which is the first thing that we are going to do to break our fast, our first dish is always preferable to start with vegetable. And I would really advise vegetable soup because not only it's providing us with vegetable, but also with fluid to hydrate a little bit our esophagus after a long period of fasting. So vegetable soup, broccoli soup, tomato soup, minestrone soup. We have plenty of very nice soups for iftar that could be used. For people who don't like soup, salads could be an excellent choice. And even for people who don't like to eat raw vegetables, cooked vegetables and dishes with cooked vegetables are really also excellent choices. Artichoke, broccoli, cauliflower, they are very rich in fiber vegetables, and they could be very helpful at the starter of the dish with while providing us with a lot of fiber. Our main dish should be a combination of protein and healthy carbs. And the healthy carbs, like we said again, it has to be a moderate portion, not a full plate of carbs. It has to be a moderate portion with a good amount of protein to be able to reach our requirement of protein. So meat, fish, chicken, yes, with some basmati rice, brown rice, and if we can have some pulses like chickpeas, lentils, they could be a great option. For vegan or vegetarian who don't eat meat, fish, or chicken, the pulses, the lentils, the chickpeas, the fava beans are excellent source of plant protein and very healthy. Also, let's try to remember that for these dishes, we should apply some healthy cooking method, not to put too much fat in our dishes and make them very high in calories. And again, we eat a lot probably of cheese roll, samosa. If we air fry them or put them in the oven instead of frying them, it would be also better to control our weight and the excess calories. For dessert, of course, dessert is always challenging during Ramadan because we always desire to have something sweet. And again, we have to be reasonable here. Let's try to opt to healthier desserts. So a fruit salad could be an excellent, nice thing to have as a dessert. Having the dried fruit with some nuts, again, as a dessert is a good option. But we can also make very nice desserts based on pudding, nuts, fruit puddings, and even regular recipes of dessert for Ramadan can be modified to be done in a lower fat and a lower and lower in sugar way. And I think if you stay tuned with us and with our social media, we are going to be posting a lot of healthy recipe for Ramadan. As for suhoor, since it would be the meal before we stopped eating, it's very important to have a high protein, high fiber with a little bit of healthy carbs. We need a little bit of healthy carbs not to have after that for a very long period a hypoglycemia. So, and the presence of protein and fiber will give us a bigger satiety effect for a longer period, and they will stabilize our blood sugar for a longer period. So for people who like to have a heavy iftar, a heavy suhoor, they can eat again something very similar to the iftar. But we usually recommend not to have a very heavy suhoor to be able to sleep after that. Light suhoor, like some eggs, probably Greek yogurt with oat and almonds, a high protein sandwich with cheese or meat, with whole wheat bread, with a lot of vegetables, also could be great options. For drinks, again, we said we need to get hydrated and we can drink several things. Water is always the best option. We should try to avoid too much sugary drinks and too much juices, because these will all make our blood sugar spikes and will provide us with a lot of calories, which we don't want. So other option could be to flavor our water with some fruits or herbs or spices. We still can get a little bit of sugar from these fruits, but it will not be very high in sugar as the real juices. Yogurt flavored with mint and spices would also a good drink, or any kind of herbal infusion. It could be drank hot or cold. They could be also a good option for drinks. And at the end of the day, whatever we want to eat in Ramadan, whatever we desire, because sometimes we desire some things that are not probably very, very healthy, we should always remember that moderation is the key. And probably if we eat a very small bite of it, it's not going to harm us. It's not going to be a big deal. So in diet and nutrition, we always say balance and moderation are really the key. Thank you so much. And we would really try to start having your question. If you have any questions.
Thank you, Rana. Let me warm up here because everyone is shy. Well, first, someone requested a PowerPoint presentation, and we're going to share later. And there's one question here. Hi, thank you, presentation. We are almost welcome. My recent blood test showed that my HbA1c is 6.9 and glucophage 1000. I have some symptoms. Is fast recommended for me? So, Cigdem, you want to address or?
Yeah, Milena, actually, I want to ask, we need to ask some more questions. If your kidney function is okay, and if you are not planning pregnancy, if you are not pregnant, and if you do not have any complications for diabetes, then you can fast, of course. But you need to monitor your blood glucose. You need to be careful with the hydration. You can do small exercising. Actually, it can be helpful for you in this case. But of course, we need to monitor your blood glucose, and please let me know if you have any other medical conditions that we need to take care of.
I'm gonna just add one more thing. For example, what are we doing in the clinic? We calculate this. There's a risk. It's easily to find. You can find on Google. You can find in different websites. And there's a risk that you put some details. If you use insulin, how many years of do you have diabetes, the duration of diabetes, and the complications, as Dr. Cigdem mentioned, then we can classify one patient is low risk, moderate risk, or high risk to fasting.
Actually, Milena, sorry, I find it to show our patients how many factors we are considering while calculating this risk. Let me share just a quick.
Yeah, sure.
Actually, your doctor, your physician will consider many factors, as Dr. Milena mentioned, before telling you are low risk or you are high risk. This is just to show you how many factors we are considering before deciding about your risk category. Yeah.
Okay, great. Let's move. Rana, this is for you.
Yes.
I need to ask if I can take granola pudding with nuts in Suhoor. I love granola pudding.
Well, yes.
Pudding,
pudding, yes, it is good to have the pudding, but I would suggest for you a better way to put it. Instead of putting the granola, or preferably not granola per se, but oat, instead of putting them only in water or in milk, which will make the dish only pure carbs, to put them, to add them on some Greek yogurt, because Greek yogurt is very rich in protein. So this way we are mixing the carbs with some protein, and probably you can add on top of them some nuts or some berries to add some fiber. And this way you're having a full meal, a mixture between protein and carbs and fiber, and not only a pudding coming from carbs, which might make your blood sugar spike.
Great, thank you. The other question is about the ideal glucose after iftar. So if it must be below 200. Actually, what are the guidelines recommend for every patient with diabetes? The glucose must be between 70 to 180. Okay, so we know that above 180, we can start and develop some complications of diabetes. So after meals, the maximum is 180. Rana, I'd like to ask one thing. What do you think is the main error that the patients can do during the Ramadan time? Because some patients after Ramadan they come to me and say, "Doctor, I gain weight. No, I'm supposed to fast. We're supposed to use soda studies. We're supposed to have a weight loss." But I believe the overeating the iftar, right? The
The
feasting.
overeating and iftar, and starting probably our iftar with too much sugary thing. Sometimes because we are a little bit dehydrated, we start drinking a lot of juices or these special syrups of Ramadan, like apricot syrups and jalab, or these drinks, and they are loaded with calories and loaded with sugar, which make the blood sugar spike immediately after eating these drinks. So we're not saying don't eat at all sugar or any carbs, but let's balance them with protein and starting with vegetable to make the absorption of the sugar in a smoother way and slower way, and not to make the blood sugar spikes. I think this is something that is very common, to start with a lot of sugary food, probably dates, a lot of dates, a lot of juices that can make our blood sugar spike immediately after we break our fast. And I see here that we have a question as, can we break the fast with dates? If it's not, I, I mean, if you want to break it because culturally this is what we do, let's keep it up to one date and put some with it some nuts to balance a little bit the sugar, and to keep if you want to eat more dates, to keep them up to 3 dates, but probably after the meal than eating immediately when we are starting our fast, breaking our fast, sorry, and break our fast with vegetables which are high in fiber would be better.
Great, thank you, Rana. Dr. Cigdem, this is for you. What is the best time to exercise?
Yeah,
Cool question.
this is very, very personal, because your conditions, your work, they're all related. And, before iftar, there is an opportunity, since you are fasting, your body will lose, will use glucose first, then you will use fat tissue, then you will be able to lose weight. But if it is convenient for you and you are feeling comfortable and you are enjoying it, then you can do it. The priority and the main message is, your body shouldn't be under stress, and you shouldn't put your body at stress for exercise during Ramadan. If it is okay for you, you can do it before iftar. But if you are not feeling comfortable, then you can do it between iftar and suhoor, like low to moderate exercise. It will be great. Also, the second important thing is doing anything what you enjoy, what you can do it during the whole Ramadan is beneficial. Doing nothing, just like walking, regular activities, it will be very, very beneficial for you. And you need to monitor your blood glucose. If you are doing exercise, if it leads to low blood glucose and if it is putting you at risk, then please try to decrease intensity and find another way to make it more healthy. Yeah, I hope I answered your question.
Thank you, Dr. Abdul Basit is raising his hand. Maybe we can take question.
Yes.
Yes, hi everyone. Thank you so much for that session. Actually, it's quite helpful for me because this would be the first Ramadan when I basically diagnosed type 2 diabetic. So I'm just curious about a couple of things. Thank you for giving me the answers for other questions. I wanted to check with Rana first that since I am basically belongs to an Asian family, so what we basically usually do, we usually break our fast with the iftar items like fruit chart, and then you can dates, and also uh, chickpea salad, and some of these one or two items for like samosa and rolls. So that usually we made our iftar table ready, and then after the isha prayer, what we are doing basically, we are taking the dinner meal. So now I wanted to ask you, so what should I do now, since now I'm taking medicine as well? So should I separate it like this as whatever we are doing right now, or should I skip some of the items from my iftar table and add dinner, include dinner in the iftar itself? So this is the first question, and the second question is what would be the ideal time to take the diabetic medication? Is it after iftar or before suhoor? That's the two things. Thank you.
Okay, so I will answer the part related to the food, and our doctors will answer you about the medication. So you said that you start your iftar, your you break your fast with sugar and fruits and dates and some samosa and probably pastries. So if you want not to have the whole meal immediately, at least don't break your fast with only the sugars, which only with only the dates or the fruits. Break it with a salad or a soup or a vegetable soup, even if you don't want to eat a full meal immediately. Once you break your fast, then you can have your proper meal with this combination of protein and healthy carbs, and probably again some more vegetables. And after that, probably have some dates if you still want to have the fruit, but not on an empty stomach. When we take sugar and pure sugar on an empty stomach, especially after a long period of fast, usually the reaction could be a high blood sugar spike. So try to start whatever you have on this table. If there is a soup or some salad, vegetables, uh, yes, to start with that, you can, if there's probably, I don't know, some protein in these salads, maybe even if it's a little bit of chickpeas, but not pure carbs or pure sugar as the first thing that we put in our mouths to break our fast. Unless you have a very low blood sugar before you had a very like a hypoglycemia before you started before eating, then if you are very low in your blood sugar, then yes, you need something sugary to raise up again your blood sugar.
Mhm. Which medication you are taking, Sheikh, for diabetes?
I'm taking 500 mg glucophage once in a day.
Once in a day.
And
So I.
also another one is basically for lipid.
Mhm.
Uh, I think Crestron 10 mg once in a day. Yeah.
Mhm. I believe you can take it, after iftar. You can take glucophage after iftar. It's okay because it will not lead. Glucophage is a medication that doesn't lead to any hypoglycemia. So, which is convenient for you is okay. You can take it in the iftar or sahur. There will be no difference. But if
Okay. So this is XR actually. I'm sorry, I forgot
no,
to tell
so
you.
that's very
Yeah.
good
Yeah.
because
Yeah.
XR means like it's prolonged release.
Yeah.
So you can take it in the iftar if it is okay for you, or if it is not possible, and if you do not want to take it in the iftar. But my understanding is that you are having iftar like mainly. So I believe it will be better to take it in the iftar.
Yeah. That's quite right. Thank you so very much.
Welcome.
Let's move it to Lamia. It's your time.
Hello. Yes. Hi. Thank you again for the presentation. I just sent a question about being a 6.9, the H1BC, and you asked me about what are the other results. I mean, I could tell you some of them, but I don't want to take a lot of time. However, I was wondering if, the risk chart that you showed, is that available online? Is that something that I can look at? Um, and just to quickly give you an idea, yes, my cholesterol is quite high. I'm at 218. My triglycerides is a 170, and in terms of uric acid is 6.3. And I mean, and that's basically it. And the C-reactive protein is a 13. So this is in terms of the renal things. Um, the renal, like, the 6.3. So yeah, my numbers, the blood test that I did was pretty high. And just like Sheikh was saying, it's my first Ramadan, with all of these sets of things to consider. And I don't really know how to, I'm new with the glucophage, I'm still getting used to it. And I just don't know really how to uh, proceed, to be honest. I'm getting some of the symptoms like constant dry mouth, things like that. So yeah, if you can tell me, what to do, and if that test that you just mentioned is available somewhere, because I want to do Ramadan safely.
Great.
Thank you.
So, thank you. I message you on the chat. There's an application app that you can download, and
Okay.
in this app, there's the risk. Of course, ideally, we need to do the pre-assessment, as Dr. Cigdem mentioned, the presentation with your doctor. Then we can calculate this. My suggestion is, of course, if you are HbA1c below 7, you have just glucophage, you don't use insulin, you are considered at least low risk with all information provided, you're considered low risk to fast. So we allowed you to fast according to URSA. But one thing that I'm suggesting is to monitor glucose with CGM or even BGM. Nowadays, the majority of the patients, they use the CGM, and try to not modify anything that you have been doing. For example, don't try different things, And I always say to my patients, I want to try different exercise, I want to try different food. This is wrong. We try to minimize the medications the first week and second week before the Ramadan, and keep the same thing the whole. My daughter Sheena wants to add something, but I don't know if you understand what I mean.
Yeah, I agree with you, Milena. And for Lamia, actually, blood glucose monitorization, since also for Shaikh, since this is the first Ramadan, CGM or BGM, if there is opportunity, of course, CGM is excellent. But if there is no opportunity, then monitoring your blood glucose will be really helpful. And also, you told us that hyperuricemia is also there. For cholesterol, there will be no problem. Actually, fasting may be helpful, and perhaps during this time, also weight loss will happen, and it will be helpful for the cholesterol. But for the hyperuricemia, your hydration will be very important. So, as Rana mentioned before, between Iftar and Suhoor, please be careful about the hydration, and keep hydrated. And low-grade exercise or medium, whatever you choose, which is suitable for you, I believe also it will helpful during Ramadan.
All right. Thank you. Thank you very much.
Welcome.
We have
Saeed, it's you.
Hi, doctor.
How are you?
Nice, alhamdulillah. Very nice presentation, very fruitful and very knowledgeable information we are getting from your presentation, doctor. My question is, in short, uh, in Sahur, if I take in in a proper way, I take in proteins and other all things like yogurt and plenty, around 3 or 4 glass of water I take it. And then at the opening of my fasting, I take in my insulin, and then I take in some little, as Dr. Rana said, the quantities of the proteins and all. But afterwards, if suddenly the sugar is spiking, so what is the main consequences and what is the danger of the this thing? First of all, and second thing, what can the patient do to let it down the levels? That's all. This is my simple question.
Okay, good. So let me see if I understood the scenario. The scenario is that you have your suhoor, you have your insulin 20 minutes before, and this suhoor contains protein, right? We know that
Correct.
protein and fat can spike the glucose even to 3-4 hours later. We know that. Different from the simple carbs, can spike in 10-15 minutes, but the protein fat can spike later. So you are asking us what to do after 3 hours that you still have a hyperglycemia in case of you miscalculate or delay the bolus. You can do another correction. If we monitor with CGM and we see the arrow going up, we can do another bolus. Having insulin does not break your fast. So we can do the correction. But always we need to check the arrows. If you say, I don't have insulin right now, what do we need to do? Remember that the hydration and, but in this case, and of course, just you need to break the fast. If it's around above 250, you have to break the fasting and have some water and also exercise. The moment that we walk, we reduce the glucose. Remember this, 15 minutes after or before the food can help you to reduce the glucose after meals. But the moment that is above 250, you need to break the fast, have water, and inject your insulin for correction, your quick insulin.
May I suggest, doctor, that don't delay so much your suhoor, like have it maximum around 1 o'clock. This way, if you're having a hypo, you can take something you eat, or on the opposite, if you're having these spikes that Dr. Milena that just mentioned, you can take the correction that Dr. Milena just mentioned, and this way you would be covered both case scenario. You have still have time to eat, or you have time to correct because it will still during the eating period, not the fasting period. So if you don't take your suhoor very, very late, you still have time to see the effect on your blood sugar and either take a correction or eat something if you have a low blood sugar. So
we must remember that the quick insulin can last for maximum 5 hours. So the moment that we inject our quick insulin, we need to think about this time and check the errors on the sensor. This is very important. The moment that the error goes up, means in 1 hour, you intend to have 60 to 100 milligrams more than the number that is showing. So we have ideally we have some minutes to decide, minutes, we have half an hour. We don't need to do overcorrection. So check it always the errors. Did we answer?
Understand. Very clear, doctor. Thank you. Thank you.
Great. Let me see if we have any other question. I put here my email again in case anyone wants to ask anything. And of course, everyone who needs to do the pre-assessment can book it with us. We have the telephone number 0800 group care. You can
email as well.
Book a pre-assessment of Ramadan with us, me and Dr. Cigdem, and also other doctors in the clinic. We still have time to have a safe and blessed Ramadan.
Yes.
Yeah.
Thank you.
Thanks for joining us. Yes.
Yes, let's finalize, and Ramadan Kareem for everyone.
Yeah. Ramadan
Thank you, Dr.
Kareem.
Musna. Thank you, Dr.
Thank you.
Cigdem.
Thank
Thank
you
you,
all. Thank you,
everybody.
Ramadan Kareem.
Yeah. Thanks to all.
Thank you, everybody, for joining us. Thank you.